guys, this is Dr. Hub. Today we look at the EDS. EDS is nothing but the Ehler danlos syndrome. So first we look at the class 1, the classic type or the type 1 or 2. So the finding here is that the skin, it involves the skin, the joint, as well as it causes the hypermotility. And there is also involvement of there's atrophic scars as well as there's easy bruising. So how is the inheritance pattern here? The inheritance pattern is going to be AD, that is autosomal dominant, and the gene defect will be the COL5A1 as well as the COL5A2. They are the gene defects. Next we move on to the next type, that is a hypermobility or the type 3. So here the clinical finding involves the joint hypermotility, and this is mobility, as well as there is pains and the dislocations. So how is the inheritance pattern? This is going to be autosomal dominant, and the gene defects are nothing significant. Next we look at the vascular or the type 4. So vascular, the type 4, the clinical findings is that there is skin, there is thin skin, and there is also the arterial or the uterine rupture. And then comes the presence of bruising as well as the small joint hyperextensibility. So the inheritance here, it is AD, that is autosomal dominant. And what about the gene defect? The gene defect is the involvement of the COL3A1. This is in terms of the vascular type. Next we move on to the kyphoscoliosis. Kyphoscoliosis is nothing but the type 6, and what is happening here is there is the hypotonia as well as the joint laxity. Next there is the congenital scoliosis as well as there is ocular fragility. So how is the inheritance pattern here? It is autosomal recessive. Till now what we saw was autosomal dominant, here it is autosomal recessive, and the gene defects, if you see, it will be the PLOD1. Next we move on to the next type, arthrochalasia. So in arthrochalasia, or it is known as the type 7A and B. So here what is the clinical findings? There is a severe joint hypermobility, and there is also presence of skin changes. And skin changes is going to be mild. Then there is a scoliosis as well as there is presence of bruising. So how is the inheritance pattern in terms of the arthrochalasia? The inheritance is going to be autosomal dominant. So till now only one was recessive, that is a kyphoscoliosis, and here it is autosomal dominant. And let's look at the gene defects in the arthrochalasia. It is a COL1A1 and COL1A2. Next, the last one is going to be the dermatosparaxis. This is nothing but the type 7C. So how is the clinical findings? The clinical findings will be severe skin fragility. So the severe skin fragility as well as the cutis laxa and the bruising. Now let's look at the inheritance. Inheritance here is nothing but it is going to be autosomal recessive, and looking at the gene defects, it will be the ADAM TS2, ADAM S2.